What we're actually trying to do, it's quite a simple idea, but it's very important. What we're trying to do is develop a blood test that we can use to predict and monitor disability in patients. We know that the course of MS is unpredictable, with some patients having very minor symptoms and others developing very rapidly progressing disease. So what we hope to achieve by developing this type of blood test is to have a new tool that we can use to perhaps identify patients that are likely to have progressive disease, so that perhaps we can target them more aggressively with the existing therapies. Also, what we hope this blood test might be useful for is actually measuring how well patients are responding to therapies, so that we can perhaps make more informed decisions about how to modify their treatments. And what we really hope to achieve with this blood test is to develop a new way for testing therapies that are specifically targeted at disability in MS. So what our blood test actually does is designed to measure a protein that is released from damaged nerve fibres, which are coated by the myelin sheath. And what we understand in MS is that nerve fibre damage is likely to be the main cause of progressive disability. So we really do need to be able to measure this damage in order to design therapies against nerve fibre injury, so that we can start to really design the drugs that we need to minimise disability. What we're doing at the moment is we're actively testing our new blood test in trials with MS patients. And so far, over the last year, we've had some pretty promising results where we've shown that it can be used to, in fact, detect a protein that seems to be increased in some patients that have more rapidly progressing disease. So the next step over the next few years is to find out what the test can actually tell us about the disease, and start to look at ways that we can actually use this in the clinic to improve outcomes. And really, I think the answers will come within the next few years, whether it's going to be something that's useful. And from those trials, hopefully, we'll have an indication of when it might be implicated or sort of used in the clinic, I guess, yeah.